Hello, Dr. Keith Smith with you, Surgery Center of Oklahoma. Thanks for watching this video blog series. I've been particularly inspired by the Austrian economist Murray Rothbard, and maybe in particular the big smile he had on his face even when he was talking about something that was just horrendously evil. We're going to do that today, and I'm going to try to continue smiling while I go over some finer points of the electronic medical records scam, is how I refer to it. I know of no other way to refer to it. Rothbard taught us, didn't really teach us, but he stressed the historical method of looking back. He asked in Latin, cui bono, who benefits? That is how he attacked any sort of historical episode where he tried to dig through the lies, forget what we were told by the tyrants, and get really to the truth. He just simply asked who was the beneficiary of this law or this assassination or whatever, and started with them. Well, this applies perfectly to the electronic medical records industry. Let me explain. Obviously, the people who are selling these electronic medical records benefit from these systems being bought. You say, wait, electronic medical records, this is a good thing. If I go to a hospital emergency room and they don't know who I am, they'll know all of my meds and all of my past history, and that is such a gargantuan and complicated lie that is the subject of a subsequent video blog that we'll go over here in the next blog. There is a market for these systems. There is. Ophthalmologists, for instance, can take pictures of people's eyes and compare that from visit to visit. It's easy for a primary care doc who's on call for the weekend to be at home and look at a patient's current medication list and past history and allergies when they make a decision over the phone to treat someone. There's no doubt there's a market for these systems. The people who made these systems, though, were not satisfied that the market was big enough, and so they did what all cronies do, capitalists. They go to Washington with their checkbook and they buy the force of the government. So these systems are basically mandated for purchase now. The refusal to purchase them is met with severe cuts in Medicare patients to those who choose not to buy these systems. How would you like to own a business that had a product or service, the purchase of which was mandatory? And you think that's a moneymaker? That's the biggest part of why this happened. But there were other beneficiaries of the electronic medical records entering the marketplace. The hospitals. There are so many advantages the hospitals gained, the big hospitals gained by having these systems. We'll go over them one at a time. First, these systems allow the hospitals to mandate the ordering of certain lab tests, certain consultations like nutrition consultations, certain therapies, and even if the physicians who are admitting the patients to the hospital don't believe that some of these tests are necessary or indicated, many times the physicians are not able to delete those orders. So the hospitals figure out what generates the most revenue, and those tests and therapies appear in the admission orders, and those things happen whether anybody believes they're indicated or not, generating sufficient revenue for the hospitals to embrace these scams. The other thing is these electronic medical record systems are expensive. This is something the big hospitals really don't mind because they know their smaller competitors oftentimes can't buy these systems and can't comply with these regulations and rules, and it makes them more amenable to an offer that they can't refuse from one of the large syndicated hospitals. Rural hospitals are particularly victimized by this strategy. It's the big hospitals probably have already come into their small town and bought up all of the physician practices and told those physicians not to refer to that small hospital, otherwise their job is in jeopardy. The physicians refer then to the mothership, their employer's hospital. The small hospital has more and more difficulty in the small town surviving and is likely victimized subsequently by a hostile takeover. The physician practices are taken over partly because of these electronic medical record systems as well. Many physicians have not been able to scrounge up $100,000 just to buy an electronic medical record system, and so they throw up their hands and they say, I just want to practice medicine. I'll just be an employee. So these electronic medical record systems have enabled the hospitals to much more easily take over physician practices. The other thing is the hospitals make more money because the physicians, once they employ them, they can simply cut and paste Wednesday's visit to the patient in the hospital onto Thursday. And maybe Wednesday's visit was a very intense, long visit. Well, Thursday's is going to look like that too if it's a cut and paste. Whereas in the old days, if it was a cursory visit, there was a note in the chart and anything that was pertinent was visible. And there weren't huge, gigantic charges generated because of the lack of this ability to cut and paste that we see now. We also see the electronic medical records being used to economically credential physicians. If a physician, for one reason or another, is using therapies or modalities or treatments or drugs that are not generating huge revenue for the hospital is able to target those physicians, and they go before the credentials committee, and they can be very easily picked out using these systems. Another thing that can be easily tracked is the physicians who work for a hospital who figure that their patient needs to go see a surgeon, for instance, who's not necessarily a hospital employee. These are called leaky doctors. Their referrals are characterized as leaky. They don't keep everything in the family. These referrals are just ceaselessly tracked by the hospitals to identify these physicians who don't keep everything in the family. And it's a very big brotherish sort of thing that goes on with these electronic medical records. These are just some of the advantages that the hospitals have acquired through the employment of these systems. In the next video blog, we will talk about why the government was more than happy to hand this sort of thing down to all of us. The hospitals love it. The people who sell these systems love it. And in the next video blog, we'll talk about why the government was behind it and willing to subsidize it. Thank you for watching once again. Visit our website, surgerycenterok.com. Thank you.